Ça va pas être long pour Monsieur Legault. Monsieur Legault s'en vient. Tout le monde. Bonjour à tous, bienvenue à cette conférence.
Hello, everyone, and welcome to this press conference on the situation of COVID-19 in Quebec. Today, Mr. Legault is together with Mr. Dubé, the Minister of Health and Social Services, and Dr. Horacio Arruda, the National Director of Public Health of Quebec. Mr. Premier.
Bonjour tout le monde.
Hello, everyone. First, we're going to start with the good news. The number of cases, the number of new cases on a daily basis continues decreasing. Last week, I was saying that we had gone from an average of 2,500 to an average of about 2,000 new cases per day. This week, we went from 2,000 to 1,500 daily cases. Of course, depending on the number of tests that are conducted every day, the numbers vary, but the average is now around 1,500, so that is good news. And I think that it comes and confirms this lowering of cases, that the measures are working, including the curfew. And I understand that it's hard, but it's important to say it. The state is there to protect society in its entirety and the common good. There is no one who can be excluded from those measures. So it's applicable across the board to everyone. There can't be groups or individuals who decide, I'm not going to be following those guidelines, because that has an impact on society as a whole. And we as a state have that responsibility of having those measures be applied. And of course, I wish to thank all those who respect the guidelines, and I also wish to thank the police officers who are doing excellent work in order to apply those measures. It saves lives, it avoids having people end up in hospitals, and of course, it avoids delaying surgeries. Speaking of hospitalizations, there was a decrease. We went from 1,500 to 1,400, a little over 1,300. That's still very high, particularly in Montreal. There's 1,040 in the Greater Montreal area. So the situation continues being very difficult in the hospitals of the Greater Montreal area. And what that brings, well, two things. First, we have employees who have been, for 11 months now, who've been working very hard because they have their regular job plus the impacts of COVID. And it also, of course, has an impact on the waiting lists. So there's still surgeries or other medical activities not being done, treatments and others. And I understand that there are Quebecers who are anxious because they can't get a close date for their operations. Therefore, of course, we must continue with that work. We can't think that the situation, because there's been a decrease in cases, we're still at 1,300 of hospitalizations, so it's going to have to go down a great deal more than that. Next week, we should, if the trend continues, we should be able to announce to you a certain slackening of certain measures in certain regions of Quebec. Of course, everybody can see that the situation is very different in the Greater Montreal area as compared to the rest of Quebec. So it will be a slackening that will be different depending on the region. That will be announced next week to be applied on the 8th of February. In the meantime, what is important, and I'm going to repeat it, I think, every time, we have to be careful with the people 65 and over. 80% of hospitalizations, 95% of deaths are in that age group, people who are 65 and over. So we have to avoid visiting them. I think that even if we don't have the evidence, one of the reasons why we see a decreased lowering is because there are fewer visits in homes after 8 p.m. in the evening. But even in the daytime, we have to avoid visiting people 65 and over. We'll do that once the pandemic is over. We'll visit them more. But in the meantime, unless it's absolutely necessary, unless it is like a caregiver, in order to avoid, we have to avoid visiting people 65 and over. The other subject that I wanted to speak to you about are the variants of the virus that we see everywhere in the world and their impacts on the spread of the virus. I'm sure you've seen what's going on in Europe, in Alberta, and in Ontario, our neighbors, where we can see it's catastrophic when that variant arrives. With the travelers who come from outside, it brings about a spread that is almost exponential. So I do not understand Mr. Trudeau. I listened to him quite closely earlier on, who repeated the same guidelines, but I think that Mr. Trudeau has all the power that he needs, either to forbid non-essential international traveling or to force people who are coming on flights from outside of Canada to be quarantined in supervised hotels, which would be, of course, would have to be paid by the travelers themselves. And I don't understand, every day there are travelers coming in, so every day that goes by, there is an added risk. So it's urgent to act. So I request, once again, I ask Mr. Trudeau once again to act more quickly, either to forbid international non-essential travel or to force incoming travelers to stay at the hotel so that they can go through a quarantine. So that is very important. The other thing that's very important that has to do with the federal government is everything having to do with the doses. Every single province has accepted that it be the federal government that negotiate with the manufacturers. But we're all concerned right now. We can see that our vaccines come from Europe. It seems they can't come from the U.S., and now we saw what the president of the European Commission says, who said that they should keep the vaccines manufactured in Europe for Europeans. This is very worrisome because we still have an important part of the population in Quebec that is not vaccinated. So it's a question of lives. There are lives at stake. And so once again, I ask Mr. Trudeau to see everything that can be done. Mr. Trudeau tells us that there are standards in CHSLDs and is negotiating with certain provinces to have standards in CHSLDs. First of all, it's not up to the federal government. And second, I think that he should care more or do more as far as foreign travelers are concerned, as well as the doses. A word on the economy to end with, because although we're working really hard to reduce the risks of the pandemic, I can tell you that we're working very hard as well to prepare the economy. First, I wish to talk to you about a report that came out, the FCEI, so the Canadian Federation of Independent Businesses, last week, that shows that throughout Canada, there are 17% of companies that are at risk of closing down. In Ontario, it's 20%. And in Quebec, it is a province where the rate is lowest, 11%. So 11% in Quebec, 20% in Ontario. That means that the work that we've done since the beginning of the pandemic to help companies has had better results in Quebec than in all other provinces in Canada. What I want to say as well is that we are ready for a recovery. What my target is an economic boom in the second part of 2021. In the year 2022, it's going to be an economic recovery. Well, we'll be able to have new opportunities. There will be a new economy, so more Quebec companies that manufacture here products that are or were imported, more Quebec companies that will be in the sector of green economies, and more Quebec companies that will be in the digital sector as well, which is going to be in even more growth because of the pandemic. So I'd like to end by telling Quebecers, let's be patient and let's keep our hopes up.
Starting with the good news, the number of new cases continues to decrease. This means that our measures are working. I want to thank all Quebecers who follow the rules and our police officers who apply them. I know it's difficult, but the rules apply to everyone, and they are for the common good. Number of hospitalizations is also decreasing, but it's still too high. Surgeries are still being delayed. We must continue our efforts to reduce the number of people in our hospitals. The situation is more difficult in the greater Montreal area, but we must continue our efforts in all regions. We hope next week that we'll be able to announce a lifting of certain measures after February the 8th. We'll take into account the situation in each region. But we have to stay careful, especially with the people over 65. We have more reason to be careful with the new variants of the virus. We're seeing the effects it's having in Ontario right now, and I repeat our demand to Mr. Trudeau, it's time to act. We can either ban non-essential travels or isolate travelers in hotels. We're also concerned about the reduction of vaccine doses. It's urgent that we receive as many doses as possible. There are lives at stake. So we have to stay patient and we have to keep our spirits up. Thank you. Maintenant, je vais passer la parole.
Now I'll hand over the mic to the Minister of Health, who will talk to you about vaccination. Mass vaccination, which is ready when we get the doses. So hello, everyone. Perhaps just to take a few minutes on vaccination itself. First, we're going to start with the good news again. The good news is that yesterday we got to our objective of 225 vaccinated people 2 weeks before the objective, which was the 8th of February. So not only is that excellent news, but I'd like to take advantage of this to thank all the vaccination staff, the entire team that works with Daniel Paris. They do very difficult work, particularly in the first weeks. So what we were able to show is that when we get the doses, we vaccinate. We're even ahead of time. So, of course, the slowdown of which the Premier spoke will have an impact over the next few weeks. We already see this week's that we've already gone down to 5,000 compared to what we had already done over the past days. I try to update you every day when we have news. We put it in different networks. Next week, Pfizer, 8,000 doses, Moderna, 40,000 doses. That's far from what we were planning on, but it's still at least next week some doses are coming in. So the slowdown, of course, is going to have an impact on what we're doing. But what I want to reassure the population of is also to say that during that time, we are still doing work to keep with the momentum. So perhaps just to remind people who are looking forward to this, because we're supposed to start with the RPAs. We did a few people who live in RPAs, but not as much as we wanted. So I would like to remind you of all three phases. The first one, which is the present phase, is really the vulnerable people, the workers who work in health. We've done almost half already, so that is also good news, and people who are in critical care. The second phase is what we will call vaccination per age category. So once we leave the RPAs, we're going to take the 80 and over, then the 70 and over. So that will be the second phase that we really look forward to getting to, because that is where the hospitalizations are, as you'll recall. And the third phase is the vaccination of the public at large. And each of the phases, I will remind you, has different strategy, because you remember why we took Pfizer at the beginning, even if it was more difficult, because we wanted to go there. But with the vaccines coming in, we'll be able to go more quickly. And now to talk a little bit about people who give the vaccines, because, you know, it's like, hey, we'd like to raise our hands, we'd like to do it. I'd like to remind you that first, to prepare ourselves, we have two great centers, and we have we'll have images available, and I so look forward to being able to see 200, 300, 400,000 people per week getting vaccinated. So we took the Congress Center in Montreal, the Centre des Foires in Quebec. Maybe you saw a few pictures of the places that we're making available. It's just to show you to what extent we can vaccinate quickly, because for us, I'd like to remind you, vaccination, we were able to do 250,000 people per week, and that's with the staff that we have right now. So the new vaccinators who are being trained right now will be able to go up to 300 or 400,000 people per week. So I would just like to remind everyone that that's why we're asking for more vaccines, because we're ready for them. And I think that we have to tell the manufacturers, and we were talking with Pfizer this morning, with whom we have a good relationship, and they're telling us that they understand people's concerns, but at the same time, there is no change. There's a lot of rumors that we've been hearing, but I would like to reassure people that as soon as our doses come in, we will keep you informed, and we will be vaccinating quickly. Thank you. Thank you, Minister. We'll now go to the question period.
Virtuellement, donc ceux qui sont en ligne, veuillez simplement lever la main sur votre application. On va prendre une sous-question par journaliste. On va débuter avec Ariane Lacourcière de la Presse.
I'd like to know, you said that you were going to announce a potential deconfinement in certain regions. Is that a good idea right now? Considering that some regions, you know, when they deconfine, they end up rising numbers. Well, we do that together with public health. You'll notice we haven't announced anything today. We're giving ourselves another week for an announcement, or for a starting date of the 8th of February. It has to be said there's still active cases in every single region of Quebec with no exception, but there are regions where there are fewer, where things are going a little bit better in hospital settings. So that will be part of the discussions that we'll be having over the next few days, and should be able to announce what we'll be able to do on the 8th of February. But we are prudent. Expect, particularly in the greater Montreal area, that significant measures are still going to be present. Many media this morning signed an open letter, and that is rare that we see all the media getting together to say that it would be important that we be able to go into hospitals to show people the pandemic. There are even doctors who themselves are asking, why is Quebec standing apart? It's one of the rare places where we can't go into hospitals. Yes, I'll start. I asked, and I understand very well the reasons that had been evoked up until now by public health, because, you know, when we have to make difficult decisions like with Dr. Arruda to not let in caregivers, and at the same time we ask journalists to go in, we can understand that it's different, but that's what we have to balance. So what I asked Public Health and Dr. Arruda, following the request that we got over the next few days, would it be possible to go over that decision again, which gave him the time to prepare himself, and I think that I'd like him to talk now. We're very open to people's requests. I wouldn't want you to think that we're not. Right now we're at war against a virus that has asked us to forbid even people from going to see their next of kin, their loved ones. There are even people having to mourn remotely. So, and these places are also overloaded as well. So we wanted to be prudent, but we understand the situation, and we are going under certain conditions and clear rules and a protocol as well to avoid contaminating journalists or that there be an introduction. So in all equity, I will also say with others, we're probably going to arrive with a short-term solution to allow that freedom of the press to show images as such, but not removing the balance of the access of others. You'll understand that a family who can't go see, for example, their close of kin, their mother, they might ask themselves questions seeing that journalists can go in. So we'll be asking ourselves the question. Mr. Legault, many times over the past few days, and particularly today, you've called out to Justin Trudeau. You said that it's urgent to act in terms of the vaccines, but also travelers. I'd like to know what is the feeling that you have within you right now that animates you. Well, I must admit that I have a hard time understanding why making that decision is taking such a long time, particularly that to force travelers arriving in Canada, or at the very least in Quebec, of isolating themselves in a supervised hotel. I don't get it. Last Friday, the Sûreté du Québec accepted doing part of the RCMP's work to do a follow-up to people quarantining at home, but the Sûreté du Québec is not allowed giving fines. So we can say that it's perhaps not, it's certainly not perfectly efficient. So I don't get it. There's already countries that have done this. They've set it up, mandatory supervised hotel. I could perhaps understand, and that is why I offered a sort of choice to Mr. Trudeau of saying either we forbid traveling, and now I understand that there are rules of law that pose certain issues, but I do not see a problem with forcing travelers of going into a supervised hotel for 2 weeks. And every day there are travelers arriving in Quebec, and we saw it. We've seen it in Ontario. We already have a few variants in Quebec, and when I talk about it with Dr. Arruda, what he tells me is that, in fact, it could, from one day to the next, explode, restart exploding, the number of cases because of the variants. So we're in the same situation as at the beginning of March of last year, where we had a hard time with Mr. Trudeau to make him act quickly to prevent travelers from coming and infecting the population here in Quebec. My next question is about essential products being sold. The Minister Fitzgibbon this morning said that there were essential products, but said that there was a certain decision that was abhorrent. Are you going to review the list of essential products to avoid incoherent situations? Well, it depends on the regions, I would say, and even of neighborhoods. There are people who are telling me that they have no problems in getting clothes, for example, at the door of a store. You call and you agree, and you go pick up the product, curbside pickup. But should we review essential products? Well, we were saying earlier on that there's going to be announcements for the 8th of February, and it's about 10 days. So that's pretty soon. We don't want to purposely open too quickly and have a risk of spreading the virus. So it's that balance that we're playing with. But I understand that, a snowsuit for a child who no longer has them, or snow boots for a child that doesn't have them, or even an adult, it's pretty close to being essential. So I've asked for that to get looked at. But once again, I would invite people who are listening to us to call the stores, who very often will give curbside pickup service.
Oui, bonjour. J'entends bien, Monsieur Legault.
Mr. Legault, you expressed the fact that you're not satisfied with the federal government because of travelers, but you said that beyond what Ottawa would do,
discussion avec
you had discussion with the Minister for Public Safety, Ms. Guilbeault, to know what Quebec can do as well. So would it be possible for Quebec to act alone, or is it completely impossible? Well, we've done a bit of work since last Friday. The SQ, the Sûreté du Québec, has been acting for the RCMP to do the follow-up, or a sort of follow-up, of people quarantining at home. For the time being, the Sûreté du Québec does not have the right to emit fines or tickets. We are continuing with discussions about this because I would like at least to be able to give out fines. But the real solution, and I do not understand why, we're so late with it, we could say, as of tomorrow morning, everybody arriving, we put them into supervised hotels, and that would fix the problem. Over the past few days, the Montreal police officers intervened many times in synagogues of the Hasidic Jewish community. There would seem to be a certain amount of confusion in the application of the rules last year, where places of worship have different rules. Why have chosen to announce a slackening of those rules, whereas all the other rules remain the same on the 8th of February in Quebec? Well, first it was a recommendation of public health to say 10 people, and it was supposed to be that. But then there are some people who thought that they would be, sneaky and decided that because they had 3 doors, they could have 30. But no, it was a maximum of 10 in a building. But the law is the same for everyone, for all communities, for all religions. It's a question of common good. It's a question of protecting the public at large and the community at large. So there won't be any religion that will have more rights than another.
On va passer maintenant à Charles Le Cavalier du Journal de Québec.
Bonjour, Monsieur le Premier ministre. Bonjour. Sur la fermeture des commerces, je veux revenir là-dessus.
I'd like to come back to the closure of stores. You talked about the clothing for children that could be at curbside pickup, but it's really difficult to try clothes without trying them on ahead of time. And there's all sorts of other problems. Not everybody has a credit card to be able to do online transactions. And I understand that you made that decision because you didn't want to only big box stores to profit from it. But is that going to continue for a long time, even after the 8th of February, even in Montreal, the fact that we can't buy these items in stores? Well, I hope that next week we'll be able to announce some slackening of measures in stores for the 8th of February. In the meantime, whether it be a delivery or whether it be picking up the purchase at the door of the store, that can be done. And that is why we've done it. Because basically, a lot of products can be essential when you ask for them. Of course, medication and food, that is truly essential. But it has to be understood as well that it's a situation that is quite particular. As Dr. Arruda was saying earlier on, it's a little bit like being at war against a virus. So we take measures that are really exceptional, and we have to make sure that we avoid contacts as much as possible. And there are contacts in stores, so the more we close stores, the better. And of course, a picnic table in the wintertime is probably not an essential good, but a snowsuit for a child is a lot closer to being an essential need. So I haven't found, the guiding principle, but we'll adjust ourselves. I would like to just really understand. Is the law on public health, would that allow forcing all travelers who arrive, for example, at the Montreal hospital to go in quarantined, supervised hotels? Well, the question of interventions with travelers has to do with the Quarantine Act, which is a federal law. There would be the possibility, possibly, depending on the threat to public health, to use the Act on Public Health if we are in the context of an apprehended threat, which is different from an effective threat. But I would have to consult the lawyers to see the competition between the different laws. But at any rate, it's not only a question of law, it's a question of willingness to intervene and of doing things. I think that there is a Quarantine Act. It's available. We can decide that we let people do things themselves, but we know that for all sorts of reasons, when it's not that those measures, in order to work, they have to be done completely. Half measures very often, unfortunately, make it that the border will remain open somehow because there will be all sorts of holes. The Quarantine Act would allow us to do that, so that is the one that we should have.
Oui, bonjour à tous les trois.
Bonjour.
You mentioned that certain slackening were thought of for certain regions of Quebec as of the 8th of February, and we know that you are keeping an eye on cases and hospitalizations very closely, and that allows you to planify in the short and the middle term. You probably already know which regions you're going to be talking about next week. What are they? Well, listen, I'm not surprised with your question, but we'll just ask you to be patient. I would like to remind you, and that is why we published our new chart today. We're coming back to the 3 criteria. I know that we are repeating ourselves, but there's a question of the cases themselves. You've seen that the evolution is positive. On hospitalizations, it's coming, but not quickly enough. As far as outbreaks are concerned, we still have a lot of them. That's the part at the bottom left of the chart. You have to remember that those are the 3 main criteria that we look at. There's another one that you know about that we've talked about very often. It's everything having to do with the surgeries that we postpone. Because behind the hospitalizations, you have to think that every time that we stay with such high numbers, 1,300, 1,400, in Montreal, we already have over 50% of medical treatments and surgeries that have been postponed. So the chart gives you the general overview, but there's a lot of other things behind it, and that is why today we're saying we have to be prudent. We have a trend that seems to be going in the right direction, but on top of it, when you take the regional factor into account, Montreal is not the same place as Quebec and is not the same place as Saguenay. So that is why today, I know that you're asking us what the regions are, but we're giving you the tools which are ours to be able to do that evaluation. But I think that that is something that will have to be done all together over the next few weeks to be able to take everything into account. So we're going forward. That is the message that we wanted to give you. Things are encouraging, but we have to remain very prudent so that it continues to go in the right direction. And after that, we'll be able to talk about, as the Premier was saying, which regions might be able to benefit from which slackening. Just to tell you that the efforts of Quebecers have been fruitful. We can see that the number that was high, it was going to go down. And we still have impacts on hospitalizations. There are still hospitals that are leaving, treatment aside, staff is tired, so everything is improving, but it is unstable. So with the arrival of a new variant, or with a variant, or if people slacken, and I'm taking an exaggerated image if I talk about a party, but we're talking about just everyday things, like little faucets that we open, that we close, that we open. We have to go prudently. I don't want you to think that the next few weeks is going to bring us back to how we were before. That would be the most dangerous thing. We're still in this war. The light at the end of the tunnel is the vaccine, but as long as it's not there, we're going to have to continue with wearing the mask, distancing 2 meters, the hand hygiene, and we won't be able to do things hidden like we used to do it. So I don't want to be a harbinger of doom, but don't expect, and I'm sorry, Mr. Premier, to say that, but I think that we're still in a fragile situation. I don't want people to interpret things thinking that as of the 8th, everything is going to go back to what it was. and let's go. It's not what it's going to be. As far as the second doses are concerned, the government committed itself to give the second dose within a 90-day delay. And since then, we had a delivery delay by Pfizer and also the bad news that we learned from Europe today. Does that modify your vaccination plan? Usually what you have to understand, and we said it, is that we're going to do a follow-up of the vaccine efficacy. Our question of moving around the second dose, we are in contact with England, with the United Kingdom, with Israel to see the preliminary data that they have. And it is clear that if we have the vaccine, we will be adjusting things according to what we think the groups that should be able to get the second dose. So it's clear that the most limiting element is the quantity of vaccines, but we're also going to continue looking at our decision that was made together with our Quebec expert on the question of the second dose. So if we have a vaccine and we have a change of indication, we'll use it the way that, in a way as to follow the new indications. And that is what we will do.
Oui, bonjour, messieurs. Hier, le ministre...
Yesterday, Minister Gibbons said, if we maintain certain stores closed beyond the 8th of February, the risk of bankruptcy was going to multiply because of the fragility of certain businesses, of course. Are you planning, for example, one of the sectors that is having important problems right now is the restaurant owners. Are you planning on allowing the opening of restaurants in certain regions as of the 8th of February next? Well, first, the decision is going to be a health decision. So we're going to go along with the recommendation of public health. Now, to save businesses and restaurants, there are means to give financial help. I was saying earlier on that according to the Canadian Federation of Independent Businesses, when we look at all businesses, they plan that 17 businesses in Canada are at risk of closing down. There's 20% in Ontario, and it's Quebec that has the lowest percentage at 11%. That means that the programs that we have set up since the beginning of the pandemic in order to avoid these closures and to be able to get through the period where certain businesses are closed, like restaurants and businesses, well, I think that there's still work to be done. It's still very high. 11% is very high, but it's much better than the 20% in Ontario. And I was saying earlier on, we are preparing ourselves, and I still have a meeting this week with Pierre Fitzgibbon and Guy Leblanc from Investment Quebec. We are getting ready so that as soon as we have the green light from public health, a maximum of businesses have to open. I understand that you don't want to speculate on the regions, but I'm looking at the cases today, the new ones. The Bas-Saint-Laurent, no new cases. Côte-Nord, no new cases. Northern Quebec, no new cases. Gaspésie, Les Îles, one case. Might we think that those regions will have a slackening of the rules, a reopening of certain businesses, and perhaps removing the curfew? All the regions that you just mentioned have tens, if not hundreds, of active cases, so you have to be prudent. What we want is, by the 8th of February, to give ourselves as many chances as possible, first of being able to give hospitals some breathing room. You know, right now we have a lot, and the Minister for Health could talk to you about it, a lot of discussions with unions, with employees, to see how we are going to be able to start catching up in interventions and surgeries, and that is also applicable to every region of Quebec. Because in our discussions that we have every week with the unions, the summary is people are very tired. That is another criteria that is not in the chart that we filed today. But at what speed can we catch up to take into account the state of health that our staff has right now. And there's been some good discussions with union representatives last week. We had to take that into account as well, to what speed we can go back and reduce the waiting list. So that's a lot of factors, and the regions are perhaps not as affected, but there's still regions that have difficulties. Think of the Abitibi region, where there's a lack of staff. It's not always linked to COVID either. So it's all of this that has to be taken into account. We know that we're not answering, with clear numbers today, but I'm just saying that the decision is more complex to make with all these facts. So it's a summary, but we had very good discussion with union representatives, and we're going to try to do that in harmony with everybody.
Bonjour, messieurs.
You were saying that certain regions, we might see some slackening of the measures. Are you planning of bringing that together with the formal banning of interregional travel, like roadblocks? Well, the question of the roadblocks is often asked, and I've asked many people talk about it in the past few days. We always have to try to find the balance between workers who have to go from one region to another to do their work as compared to people who are going someplace for leisure. So depending on what will be decided, we'll see what regions we're talking about, their proximity to large cities like the Greater Montreal area. So I would say that yes, interregional movement is a factor that I would like people to keep in mind, depending on the kind of intervention that we want to have between the regions. The question of work is also important, because if we block an access and you see waiting lines, people, waiting in line to be able to get to work, it's not very practical. But I can tell you that it is one factor amongst others that is taken into account right now. And there's another factor to be taken into account as well. What is a priority for police officers? Because while police officers have to staff roadblocks, well, they can't keep an eye on curfews and things like that. So we have to see what the priority is as a surveillance task to give to the police officers. It also has to be understood that it is clear that if we are in a very hot zone and you go into a colder zone, to be able to benefit from the potential lifting of measures, well, that doesn't help us because you're just moving the virus around. And, regions can go down more quickly, but they can become unstable and have an impact on the healthcare system very quickly. It doesn't even require 1,000 cases. And Bas-Saint-Laurent can have a lot of problems with a lot fewer than 1,000 cases. So that is where we really have to count on everyone's collaboration. If there was to be a slackening of measures or a lifting of certain measures, that means that there will still be rules to be followed. We can't, we can't say that we're slackening this and then we forget about everything else. We still have to keep the 2 meters and the distancing and the mask, in the same way that we don't want people to go around with the virus too much. We also have to avoid giving it to one another as well. Dr. Arruda, how many cases have a variant, and what are the extra detection measures to protect ourselves against those variants? We would be, I think the last one was 6 from UK. We don't have any Brazilian strains in Quebec. There's one that would be associated to Australia, but is not very worrisome for the time being. Right now, there are about, I would say, and you have to understand as well that there can be a new strain that emerges even in Quebec. I just want to tell you, that is also one thing. The more we transmit the disease around, the more there are changes that there will be mutations, and it can be mutations that are not at all dangerous, but some can become dangerous strains. So first, everybody who comes from the outside that will have traveled, for example, in those zones at high risk, will have will be able to get screened. We'll have special investigations around those people. Right now, we're testing about 5% of all samples that are in Quebec. We are going to increase that level to 10%, which is representative. And as soon as we have a situation where there's a specific variant that is noted, the public health authorities are going to be told about it to make an investigation and avoid transmission. Thanks to the investigation that were done in the past 6 cases, there was no important transmission in any area. And that is why it's so important that when people come back from the outside of the country, that they can be isolated, make sure that if they have symptoms, that we can test them and check whether it is the new strain. And it's really important to keep with the quarantine as well because of this. Mr. Premier, I'm trying to understand what you said about the police officers. The federal government in April published a press release in which they said that the SQ police officers, or every police force in the country, had the powers to have the Quarantine Act applied. Local and provincial police officers could give, for example, a ticket to anybody who went against the Quarantine Act. So I'm trying to understand why you're saying that the police officers cannot give fines. What you have just read to me is that they can give a transcript. So what they do is they send the information to the RCMP, and the RCMP can decide whether it is appropriate to emit a fine or not. But the SQ cannot itself give that fine or that ticket. But does the SQ do it right now? Why could the SQ not do that? As an answer to Mr. Le Cavalier, I understood that perhaps there was certain notions on the Quarantine Act that could be applied so that we ourselves give quarantines in Quebec. I'm just trying to understand why it's not being acted upon. Why are we not doing it ourselves? Well, to be able to do it ourselves, we need an agreement between the Sûreté du Québec and the RCMP. For the time being, they have the right to give a record, to give that information to the RCMP, who can decide to emit a ticket or not. But what we would wish, and what we're talking about between the SQ and the RCMP, is to be able to do it ourselves, to emit the ticket ourselves, the SQ. But all of that, of course, would not be necessary if the Prime Minister of Canada could supervise hotels for travelers coming back to Canada.
On va passer avec François Carabin, Journal Métro.
Oui, bonjour.
Hello.
Bonjour, messieurs. Monsieur Legault, en début de...
Mr. Legault, at the beginning of the press conference, you were mentioning that the curfew showed that it worked. I think that you are satisfied as to its efficacy. Are you still going to take advantage of the next few days before the announcement next week to perhaps reconsider certain parts of the curfew, certain provisions of it? We're not planning on doing that right now. And a clarification on something that you mentioned a week ago in a press conference. The screening in Montreal. You wanted targeted screening in certain sectors of the Montreal region. You even alluded to screening of people who have no symptoms. Is that what is planned for? Well, 2 things. First, what was explained to me is that in neighborhoods like Montreal Nord, Rivière-des-Prairies, and Saint-Laurent, where there are many detected cases, it's pretty particular, but I was told that that is perhaps where we need to screen the least with asymptomatic people. But what is planned for is that in certain schools, for example, there may be screening of asymptomatic people. Right now, we've used mainly the rapid tests in cases where there's outbreaks so that we can get results quickly. But right now, we are seeing to use them at greater scale. But I have heard, as you did, Madame Drouin, say over the weekend, to say that there's no question of screening asymptomatic people. I went back to Mr. Arruda this morning asking why she said that. And now I'm going to hand over the mic to Mr. Arruda. Yes, we have to talk, be careful. If you're talking about asymptomatic, if you are a contact case, and you live with somebody who has symptoms, it's not the same thing as somebody who has another person who has no symptoms. So this test, the rapid test, for example, in asymptomatic people, there can be a significant proportion of false negatives. And that is why there are other means of doing it. But the usage of the rapid test is going to be done, I would say, in certain areas according to the indications that were prescribed by our group of experts. That's essentially what it is. If you've been in contact with a case in your household who's positive and you are asymptomatic, we're asking you to get tested. If public health asks you to get tested, you get tested. That is what is important. That is what has to be understood, because there are asymptomatic who come from nowhere, and then there's asymptomatic who have been in contact with others in specific situations. Of course, we are soon going to have massive vaccination in certain RPAs, and you said we had to be very careful with people who are 70. Right now, there's information in RPAs in Quebec City concerning the modus operandi of the vaccination. So all residents would be put on buses, like they do to send them to the casino, for mass vaccination. For example, in the Quebec sector would be Exposité. Would that be the most reasonable, safest way of vaccinating people who are in RPAs? Well, I think that Mr. Paré has explained very well that our preference, like we did in CHSLDs, when the kind of vaccine, whether it be Pfizer or Moderna, when the type of vaccination allows us to do it, we prefer vaccinating on the premises because we avoid people moving around. The issue is that there will be people who were perhaps not on the premises when we vaccinated, who were absent for one reason or another, and then we had to find a way to get those people vaccinated. But our preference, and that is why that's what we're looking at right now. We showed very well that it was possible, despite all the restrictions that we had with Pfizer, we were able to vaccinate in CHSLDs on the premises, because there we really didn't have the choice. So preferably, we have to do the same thing, particularly in residences for the elderly, which are very large, that have hundreds of people living in them. So I would say that that is our basic principle. And if we have to go further than that, for the exceptions that I just explained to you, we'll do it. But that is where we're at right now. And right now, there's meetings that have been set up with people on the premises and appointments to say on this and this day we're going to be at such and such an RPA. So I'll repeat that we look forward to getting the vaccines. And just to reassure people, when we take the 18,000 planned for next week by Pfizer, so the week of the 1st, and the 40-some thousand for Moderna, it's almost 60,000 vaccines that we will be ready to send to RPAs next week. So I do want people to be patient. I know that people are looking forward to it. We are all looking forward to everyone being vaccinated, but in RPAs, that's what the situation is right now. And I'd like to mention that the concern of not transmitting the disease with vaccination campaigns is also a priority. So if ever there was transportation of people towards centers, it's very clear that, it would be only with people where there are no outbreaks, and it has to be done adequately. That is one of the priorities for us. And we don't vaccinate the same way that we vaccinated for the flu, because there's a lot more space between people, for example. So I think that the model is always going to be we will take whichever model is the best that will allow people to get vaccinated without increasing the risk of contagion. There would be nothing worse than that. Is the government very concerned with travelers coming for flying in? But what about the quarantine of people who have contracted it here? That is a question that was asked by a colleague last week. I would invite you perhaps to answer it with more precision, because it's a question that deserves to be answered. Well, I think that there are calls that are made regularly. There are random verifications, especially if we suspect. Of course, there's nobody that goes on the premises 3 or 4 times, but the reason why we have concerns about people coming from the outside is that, of course, the strain that is circulating right now in Quebec is probably Quebecer, if you want to see it that way, one that has not necessarily muted yet. So it's less of a priority for me than to intervene with people who would come from the outside with a strain and a variant that would come from the outside. That does not mean that should not be done. The quarantine, there are calls that are made depending on capacity, but if we have the impression that certain specific people have any factors that make it that they might not respect, there's a better follow-up done. English questions now.
From Montreal Gazette.
So it sounds as if you're preparing to announce a lifting of the measures in some of the regions where the cases are much lower, and that's very good news for people who live in those regions. But here in Montreal, it's been a long curfew, it's been a long lockdown, and we're all wondering what are you planning on keeping Montreal closed and locked down until we're all vaccinated, or what measures are you looking at to start to bring these cases down faster than they are now? They're certainly coming down, but very slowly.
Okay. Unfortunately, it's too soon to answer precisely your question, but we have to understand that we have 1,040 people in the great hospitals in the Great Montreal. And right now, we have more than 50% of the surgeries that are delayed. So we really need to first start having those surgeries delayed, and we're not at this point. So we have to continue having some measures until we have a larger reduction in the number of people in hospitals in the Great Montreal.
So you can't say to what level?
Tough to answer.
Or a range?
Tough
when
to
we
answer.
can start having some hope?
Tough to answer.
And secondly, Dr. Arruda, can you talk about the variants, the state of the variants in Quebec? So which variants are here and where are they, as precisely as you can tell us?
Okay, there was, I would say, 6 UK variants. You know, there was a first batch of 4 and one other who have not been transmitted. I heard yesterday there is a 6th one. The enquete is actually done. So I think that we are implementing and already implemented genotypic look at. We were checking about 5% of all I would say the tests. We will probably go to 10 in the next days. And what reassures me is that we don't have the profile actually of, I would say, big outbreaks like it's happening elsewhere. But this thing could happen. As I was telling, we flattened the curve. We are I would say, in a phase of flattening, open going down. But if the new strain comes up, it's like, I would say, a fusee going up very fast. You have seen some curves of those tragedies happening elsewhere.
But where are the 6 cases? What region?
They are around Montreal.
We'll go with Amanda Klein from CTV.
Good afternoon. You spoke about it a bit in French, but if you can just say it in English. If Quebec does ease lockdown restrictions on certain regions, What kind of guidelines will public health put in place to avoid people traveling from hot zones to cold zones? And doesn't this create the possibility of outbreaks in regions where there aren't many cases right now?
Well, as I said, and I think that's a good question, there is one of the challenge when we have those zones, those different alert zones, is the traveling between the zone. And one of the factors that I mentioned was to say that it seems easy to say you should have a full cutoff, but you need to think about people that travel for work reason, that they need to be between. So that's the first factor. And the second factor that we need to take into account is those police officers that need to do that job. Right now, they are doing the tracing. They are doing a bunch of things that are so important that if we remove them from those tasks and put them on the watch of transfer interzone, that's another difficulty. So this is what we're looking at right now. First, let's agree on the zone that could be differentiated, and depending on the proximity and the traveling that is necessary for work, we'll try to find the right balance. But that's the reason we are taking the next few days to finalize our position on that.
Thank you. And probably this question's for Mr. Legault. Now, when it comes to the homeless community, now that there's growing pressure from the mayor of Montreal, for example, from people who work with the homeless community, there's an injunction that's been filed in court. Is the government reconsidering its position on enforcing the curfew for homeless people?
Okay, we don't expect to change it right now. Of course, we'll watch the answer to the request for the injunction. But again, I have full confidence in our police officers to use their judgment. They don't want to give tickets to homeless for no reason, just because they are outside. So I think that right now, one of the reasons of our success is because the measure is simple to be applied after 8 p.m. So for the good of all, it's better to say it this way.
Merci.
Elisabeth Zogalis from CGAD.
Hi, good afternoon. Just one question. Several English school boards are asking for its teachers to be bumped up on the priority list of vaccines because right now they're pretty much at the bottom with the other essential workers. Is that something, as more vaccines come into the province, that you may be able to pull off and do teachers before the general public?
But first, we follow the order given by the public health, so we won't change this recommendation.
It's clear that when we're going to get more vaccine, those groups that are put in one order will be vaccinated together because we get enough. But you know, the list that we have made is based on the risk of the disease for the person, based on the exposition to the person, I would say, which is different. So it's really related to, I would say, a logical, epidemiological approach. Because everybody, and even when you talk about healthcare workers, not all healthcare workers are the same risk than the others. It's why we have managed it that way. But I would say the best response I can say to you is that let's get vaccine, and then we're going to get vaccine. It's going to be very fast.
Okay. That's it. Thank you. Merci.
Okay.
We'll go with Jacob Cerebrin from the Canadian Press.
Good afternoon.
Good afternoon.
It's been 42 days since the first doses of vaccine were given to some residents at Saint Antoine, Mamadi's here in Montreal. When do you expect the second dose of vaccine, the first people in Quebec to receive the second dose of the vaccine?
First, yes, it's a good question. I would like to have the answer right now, but as I was telling, exactly the situation at Ménomide and I would say at Saint-Antoine in Quebec is actually analyzed by our experts, epidemiologists, who are really looking what did happen in that place. Because if you know, there was already an outbreak when the vaccination was made. They will look at the vaccine efficacy that on those population, and based on the results that are going to come soon, we will take the best decision to protect those persons in relation with that. It means that it could be as soon as possible for those persons, or it could be as the protection is there, we will wait before we get enough vaccine to go in our strategy.
So do you think it will be within that 90-day sort of window we heard earlier, or could it be longer than that?
We expect, I will tell you, the problem is the vaccine not available. We expect to do it as soon as we get enough vaccine. So that's it. We don't want it to go over 90 days or 84 days, which is 7 weeks, but we think that 12 weeks, we think really that that will depend also from the doses, because the approach our public health people from the Institute and myself recommend the government is to protect almost people. We think that we're going to have a better impact on dying people, on capacity of hospitalization with this strategy. And we did it not because we want it, we did it because we don't have enough vaccine.
Cathy Sonnet from CBC.
Good afternoon to all of you.
Good afternoon.
Premier Legault, basically you're almost at a dead end with Ottawa regarding banning non-essential travels. Well, first of all, your plan A was to ask Mr. Trudeau to ban non-essential travels. Plan B was to have a supervised quarantines paid by travelers. Now you are at plan C. You want the SQ to have the power to impose fines. How important will be for you to see an increase of the number of fines if finally the SQ does get that power?
Okay. First, I still stick to plan A and B's. The third one is not as good as the two first one and not good enough. And I still expect, I've watched Mr. Trudeau a couple of hours ago. I understand that he may choose A or B in the next few days, but I don't understand why it takes so much time.
So you still believe that non-essential travels will be banned?
What I understood from Mr. Trudeau today is that he's looking for one of the two, A or B, and that he should give his answer in the next few days.
Okay. I'll ask just my last question is regarding what happened with the confusion of religious gatherings over the weekend and yesterday with the Hasidic community. What do you think should happen with those tickets that have been issued by police in the name of improving relations with the Hasidic community?
Okay, the confusion last weekend was because of an answer given by Public Health in Montreal, where what they tried to do or to say is that in one building, because there were 3 doors and 3 rooms, that they may have 30 people instead of 10. So yesterday morning, first thing, I made sure that it's clear that it's 10, a maximum of 10 people per building. So it's starting yesterday, it's clear. What happened last weekend, we may look at the confusion, but now it's very clear. And what I saw is that they were more than 30.
And we have a last question from Raquel Fletcher from Global News.
Good afternoon.
Good afternoon.
In terms of the open letter that was signed by Quebec media organizations that came together, Mr. Dubé and Mr. Arruda, you have said in French that you are looking into this In the letter, they point out how important these kinds of images were in Italy, for instance, to show exactly what is happening, and more people agree or were convinced to follow the health measures because they were able to see with their own eyes what was going on. You said that you're looking into this. When can we expect a response to this? And you also mentioned that there will be conditions. What kind of conditions?
Well, as I said last week, and this is the reason I asked Dr. Arruda and his team to re-question that issue, because I think we could benefit as a society to have more information, better communication of what's really is happening in our health establishment and buildings and facilities. So I think we all agreed that there is a need for that. We agreed on that. I asked Dr. Arruda to find the condition that could be explained, what we call the PCI, Prevention and Control of Infection, for journalists that could come in the facilities, making sure that we have very strict rules for those visits or images being taken in the proper environment. What is taking a bit of time, and I think that will be, I'll leave Dr. Arruda to answer that, because as I said, we could all benefit from that. So we agree on that. The point is that we have families that have found very difficult to be not permitted to see their close one for also PCI reason, for prevention and control of infection. So we just need to have very nice and clear understanding on the way we should do it, how many facilities, and this is what I think I've asked Dr. Arruda to come up, but I'll leave him with the date to come up to you, but I think it's a matter that is being looked at very closely right now.
Yes, it's a matter of days, and I just want to make sure that I will not commit on something, but it's going to be, no, it won't be long. And as I was telling, we are in war against this virus. We had made a lot of restrictions for protecting even the journalists and the place. And all the protocols are going to be related on the number of persons who can go and what's going to be the type of protection that people must wear. And it's clear it must be also well attached with, I would say, the establishment where you're going to have to go to make sure there is no outbreak, active outbreak, or risks that could put you in danger, and also transmission in the community.
For my second question, it was just announced this afternoon, I think earlier this afternoon, that the Manitoba Premier is enacting a 2-week isolation order for travel for all travel, even travel within Western Canada, within other provinces. Is this something that the Quebec government is looking at, particularly to cut down on new variants?
Well, first I didn't hear the question. I just want to make sure that, can you just repeat the question, if you don't mind?
Yeah, sorry. The Manitoba Premier just announced today that he's invoking a 2-week isolation period for all travel, including people coming back from other provinces in Canada.
Well, honestly, I didn't have the chance to hear that this morning. Did you hear it?
In fact, as we are looking at the risk of importation of new strains, it's something that must be discussed. I would say there is federal, provincial, territorial discussions actually on that issue, especially in the context of the new strains. Like we could say, Toronto actually with some cases could be a risk to if people come here and especially not for travel and essential. So we are looking at those kind of situations. It's more complicated, I would say, in frontiers inside, but it can be done. We have seen New Brunswick, who have been very tough recommendations for not going to the Atlantic. So I think that's part of the discussions we are having with other provinces and with my colleagues in the other provinces.
C'est ce qui met fin à la conférence de presse. Merci.
Merci beaucoup.
This puts an end to the press conference. Thank you, everyone.